we have some chronic care programs. We have a congestive heart failure chronic care program, the cardio program. We have a diabetic chronic care program.
Right.
We have an ortho program. So depending on what the needs of that patient is, from that initial standpoint, then the visit may change as to what they're focusing on. We normally always look at their medications.
Right.
We're going to ask them what medicines they're on. We're going to write down what medicines they're on. We're going to be looking at what the doctor says they're supposed to be on versus what we find in the home. Because sometimes you have more than one doctor seeing that patient, and sometimes everybody doesn't know what everybody else is doing.
And yeah, that's so good.
And it's important for the patient to know all of their medications and what they're there for, what their side effects are. So we go over some of those things with the patient. And with the physical therapist, they're going to be talking to the patient about what plan does that patient have? Where was the patient before they got sick?
Yes.
Were they up walking? Were they able to go check their own mail? Were they able to feed the dog? Where do they want to get back to? With a hospice visit, it's very much a similar initial assessment, but they're going to be looking for some other things as well.
Right.
They're going to be looking at where is that patient in their disease process? What do they need to prepare the family for? What signs and symptoms does the family need to be educated on in preparation for what that patient may go through? They're going to be looking at comfort. Is the patient comfortable? Are they having pain? Do we need to change their medications? Is the pain being controlled by their medications? So there are those things that are going to be covered during that visit.
Right. And there's so many things to consider and so many things to think about. Maybe you've got an elderly patient that have forgotten to take their medicines, or maybe got it mixed up, and maybe you got to keep track of all that.
Yes, and we do teach families how to keep track of that. We do teach them how to use a Mediset, how to manage those medications that way.
Right. Yes.
Just a few tricks of the trade that we've learned in how to manage those medications and to keep those things straight.
And if somebody's got sugar diabetes, how to give the insulin shots and things of that nature?
Yes, we can teach patients and families how to do that. Depending on their insurance, some insurance companies will allow us to come in and pre-fill those syringes. Maybe you've got a patient who's able to give their own injection but can't see well enough to fill that syringe. Maybe they have no family. So depending on the payer source, some insurances will cover us coming in and pre-filling those syringes for that patient.
What about someone that is needing, part of their recovery is to lose weight? You've got a nutrition specialist or anything like that?
We actually don't have a nutrition specialist on service that goes out to the home, but we do have access to a nutritionist through a sister company, and that we can actually consult with them and make recommendations. Most of the time, our nutrition, when we're looking at a patient as far as diet, is normally we're talking to them about being healthy, not necessarily losing weight, gaining weight. We're looking at being healthy.
Okay.
So if you're a diabetic, are you eating what you need to be eating to be healthy?
Right.
If you have high blood pressure, are you eating what you need to be eating to be healthy? So that's more of a focus normally with our nurses and the conversations they have with patients about their diet rather than some
That's
of the
very
others.
good. Because a lot of older folk, they might need that because, they're stuck in tradition. I'm still going to use the lard, or I'm still going to eat a bag of sugar a day. And you can't do that. If you got sugar diabetes, you've got to be taught, hey, you need to balance things out.
Right.
So that's a great service. And I'm so thankful for the service that they're providing to the community right here in London. If some of your family is needing these services, what you need to do, you need to get on the phone, call up Victoria, have a consultation, a free consultation.
Yes.
And go into the office and just sit down and talk with her. Where are you all located in London?
We're actually located on East Laurel Road in London. Once you turn on East 80 off of 192, we're about a quarter of a mile on the left. There's actually a gas station across the street called the Get and Go.
The Get and Go?
The Get and Go, yeah. And we're actually across the street from the Get and Go.
Wonderful. So you're primarily in the office about all the time?
Yes.
And talking with people, consulting people, with your nurses, staff, and everything like that. See, this is an ongoing process. I mean, there's no time off or kicking back. You're always on the go and doing things here.
Yes, normally. And if I'm not in the office, sometimes I'm out in the field or out at meetings at the hospital. And so if I'm not actually in the hospital, there are others there that all of them are well trained to answer any of their questions.